Welcome to the MamasteFit podcast. In this episode, we're going to be discussing how you can plan for your birth. Plus, you can grab our free birth planning template in the show notes below. Welcome to the MamasteFit podcast. This is Gina, perinatal fitness trainer and birth doula.
And I'm Roxanne, labor and delivery nurse and student midwife.
And this is the MamasteFit podcast, where we empower you on your prenatal fitness, birth, and postpartum return to fitness journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable, because pain is not a requirement of pregnancy. Understand the science of birth and how to approach recovery after birth.
We share our personal experience as mothers navigating this stage in our lives, plus our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum journey.
We are glad to have you with us on this journey and that you have chosen us to support you. Welcome to the MamasteFit podcast. You may have been told that it's important to plan for birth, or you may have been told that you cannot predict birth at all, and so you should just go with the flow, whatever happens. While we agree that you can't control everything that happens during your labor, we do find it to be really important that you have some sort of plan as you go into your birth. Not necessarily as a linear plan of like, these are the things that will happen in this order, but rather taking the time to understand what your options are at different points of labor, understanding different scenarios that may happen in your birth, and understanding your preferences of those scenarios can help you feel empowered throughout your entire birth experience. One of the things that contributes towards a positive birth experience is not what happens during your birth. So an unmedicated vaginal birth does not equal positive birth. C-section doesn't equal negative birth, but rather being able to feel that you're in power and that you are making all of the decisions during your birth is what really contributes towards that positive birth experience. And so having your birth plan and taking the time to figure out what your options are and your preferences with these different options can help you have a positive birth experience.
So how do we gather the information that we want to put into our birth plan other than like what are the options that you're wanting? So if you're wanting an unmedicated birth, obviously that's on your birth plan. Like, yes, I would like an unmedicated low intervention or no intervention birth. But birth, again, we can't always predict what's going to happen. So there may be times when you may need to explore other options. And the time to learn all of those options is by taking a childbirth education course, whether it is outside of the hospital or inside the hospital, learning all of the options that are available to you. And then when you decide you learned all those options, what options do I want to know more about to see if maybe those are ones that I'd like to utilize during my birth if I need to. Then you go to your prenatal visits with all that information that you just learned in that childbirth education to then ask more questions to your provider, because they're going to be able to give you more specific information on their practices as well as their like clinics practice at the hospital. So one hospital might have nitrous oxide, for example. Another hospital doesn't have that option. So learning what is specific to your actual clinic and hospital is beneficial, and then your provider can go a little bit deeper.
So if you potentially are going to need an induction towards the end of your pregnancy due to some complications that you are developing during your pregnancy, talking with your provider about your specific medical conditions and your current pregnancy status to understand what interventions they may or may not recommend for you specifically. In addition, if you've had a C-section prior and you're trying to have a vaginal birth this time, there may be certain interventions that are not available to you, and that could also apply to other medical conditions as well. And so that can be a really good conversation to have with your provider, and is not only what is available in my clinic, but also what is available to me based on my pregnancy.
They can also go way more in depth on the different risks and benefits that your childbirth education potentially didn't have time to go into, or may not know all of the maybe more rare types of risks or benefits to those interventions. And then they may be able to explain hey, I rarely do episiotomies. These are the only instances that I really recommend them. Or I don't do forceps, or so you don't even have to worry about that. Or I only use vacuums, and these are the risks that I commonly see, or this is the time that I would commonly recommend it. So that hey, they're not going to bring this up, but also you understand what the risks and benefits are, that if in your pushing intervention time, they don't have to go through all of these risks and benefits while you're actively pushing your baby out and maybe not even listening to anything that they're saying for those risks and benefits. You can fully understand them if you need that intervention during your birth.
And I do want to say that sometimes there's a little bit of demonizing of birth interventions, that if you have an intervention such as Pitocin or if you have a vacuum or if you use anything, like this is really bad for you and bad for your birth and you're going to ruin your whole birth experience. It's important to note that birth interventions and birth options are not like evil. There's not like necessarily morality tied to them. It's about they're different tools that are available to you. And whether or not that tool makes sense to your current situation is what is really important to learn during your pregnancy, either through a childbirth education course and conversation with your provider. So not everyone needs Pitocin during their birth, but some people may need it during their labor, and there may be certain circumstances or scenarios where they feel Pitocin is a really good option for them. So instead of thinking that these birth interventions are evil or they're really bad and I should avoid them at all costs, understand what scenarios you may consider using them, and then potentially exploring like other options that may be available. So I'm not sure I want to use Pitocin right away if I'm getting induced. I would like to explore these other options first, but you need to understand what those options are so that you can feel empowered during your experience.
So when you're making a birth plan, it can also be really helpful to have a template so that you know where to start. It's kind of hard if you've never had a baby, you've never experienced birth before, this is not your full-time job, to know exactly what to put in your birth plan and like how to find out what even options are available if you didn't take a childbirth education class. So we have a birth planning template that kind of breaks down the different options available to you, but your hospital might also have a birth planning template. So I delivered at a hospital that had a template of all of the options that they had, which made it really easy for me to be able to like, yes, I would like that. No, I don't want that. Yes, I would like that. And then like rating them like this, I would like to do this one first and then second, third, fourth type thing that is specific to where you're actually delivering versus like ours obviously is a little bit more generic for any that could kind of fit anywhere that you're delivering.
There are also tons of birth planning templates online as well. Some of them have like pictures where it's like red, I don't want this, green, I want this. And so you can find one that resonates with you, but there are options available. So you have our birth planning template that's available. If you don't love it, your hospital may have one. And then just a quick Google search will give you like hundreds of birth planning templates, like just give you an idea of what options are probably available to you.
And with birth planning, it's important that we obviously have like our plan A for like what our dream birth of what we would like to happen and the options that we would like. But understanding that, again, you're going to potentially veer off on different paths during your birth and having the plan for all of those. So if you all of a sudden are planning for a vaginal birth and then it's veering towards a C-section, understanding what your birth options are for other birth outcomes, such as if you have to be induced, if you have a C-section, or potentially need those pushing interventions, understanding what the options are for all of those and having a plan in place, because it's, again, better to be over-prepared than under-prepared.
So one of the things that I have heard to do with a birth plan, which I thought was a really awesome way to think about, instead of thinking like this is like a solidified plan, like a linear plan, having it be more like a map or like a decision tree where this is the path I would like to start on, and what are the possible forks or different paths that this birth can take. So most of us are probably wanting a vaginal birth. You may be planning a cesarean birth. And so whatever your initial birth plan is will kind of be where your path starts. And then as you kind of make it to the first fork in the road, the first possible thing that could happen is you may need a labor induction or you may go into spontaneous labor. Like those are kind of the two paths for you to work towards a vaginal birth. If you go into spontaneous labor, you can kind of go down that path and explore different options that are available to you, such as, okay, I want to have a low intervention unmedicated birth. Well, maybe I hit a point where my labor is a little bit more challenging than I thought it was. Maybe it's lasting like 4 days. And instead of continuing on the unmedicated path, I want to explore pain management options. If you need an induction, exploring what are the different interventions and options available to you on the induction path. Somewhere along the vaginal birth path, you may reach a point in your path where maybe we need to look towards a C-section and exploring different options for that unplanned cesarean birth. Like what options are available in my hospital? What would I want during that birth? Like what kind of pain relief options are available to me? The other type of path that you can start on is like a scheduled C-section. So something happened during your pregnancy, or maybe this was your plan all along to have a scheduled cesarean birth. These births, you can usually have a lot more control over what's happening because it's usually a planned time. Everyone shows up at a certain time to have a baby. And so usually you have a lot more options with those as opposed to like an emergency C-section. And so same thing along that path, like what are some different things that can happen along this journey that I may need to have different options for? And then another path to consider is what happens if your labor goes super fast and you have your baby in the car, or you have your baby in an unexpected place. So that's another path to explore, and ensuring that you're prepared for that as well. So if that all feels like really overwhelming though, where you're like, well, I can't possibly plan for every single scenario that can possibly happen to me, because that would be incredibly unrealistic. The main things that I would say would be helpful to have considered would be, what is your initial birth plan? Like, what do you want your birth to look like? What is your dream birth? And kind of figure out how you can establish birth wish. So how can you set the environment for that? So if you're wanting a lower intervention birth and the hospital that you give birth at has a 50% C-section rate, that is probably not the best birth location for you. We maybe want to adjust our plan of where we're giving birth. So that would be like the initial path. What is your dream birth? What are you wanting your birth to look like? And other paths to look at is what happens if you're wanting an unmedicated birth, but then you change your mind. What pain relief options do you want to explore? The other path would be, what happens if you have to be induced or your labor has to be augmented? What options would you like to explore? And then the third one would be, what happens if you need a C-section, either a scheduled or an unplanned or a labored C-section? What options do you want available to you? So those would be like the main scenarios to look for when you're planning for your birth and understanding the different options that are there.
So what are some top things that are usually on a birth plan though? So number one is your monitoring preference, especially if you're delivering in the hospital. There are many ways that they can monitor your baby in contractions. Most are going to be doing that continuous fetal monitoring, where they're listening to both baby's heart rate as well as monitoring the contractions and how often and how long they're lasting. But there's always that option of intermittent monitoring, where they're listening to baby for like a short period of time before, during, and after a contraction, or the types of monitors that they have. Are they wireless? Are they only plugged in? Are they portable? So there's lots of options within just how they're going to monitor your baby and your contractions. And that's a common one that should be found on your birth plan to see what type of monitoring options are available to you and which ones you would like to explore.
And this would be really important, because if you're wanting to have a birth where you have lots of freedom of movement, and then you find out that your hospital really only wants you to be continuously monitored, where you're attached to a stationary machine the whole time, that's really going to impact your ability to freely labor. So that would be something that'd be important to know beforehand as you're preparing for your birth, either to find a new birth location or adjust how you're planning to, when you're going to show up to the hospital, or what you're planning to do during your labor for comfort if you're wanting a lot of that freedom of movement. Some folks will need to be continuously monitored during their labor depending on what type of intervention they're being given, or depending on their birth status. So if you're like a VBAC, usually you have to be continuously monitored, or that's typically the hospital policy that I see. So having a hospital that has Bluetooth or portable monitors would be super helpful for you if you were wanting to be able to move around a lot, to like use the shower or use the tub or change positions really easily. So understanding what your preferences are for monitoring can be really helpful, and understanding what your hospital has is equally helpful, because that can really impact what you're planning to do during your birth, potentially when you're planning to show up, and then how you're planning to labor when you make it to your birth location.
Let's take a break from this episode to hear about our sponsor, Needed, a nutrition company focused on the perinatal timeframe.
So during my pregnancy, so I'm currently pregnant with my fourth, I am using Needed to help support me nutritionally throughout my pregnancy. Right now I'm in my second trimester, so I am taking the actual pill prenatal vitamin now. I have progressed from the multivitamin powder. I am taking the pill again. I'm also including choline, so I am taking their 8 prenatal vitamins. I take about 2 of the choline. I'm taking their omega and then their vitamin D/K as well. So those are the supplements that I'm choosing to take during my pregnancy. This was something that was recommended to me by my provider, by doing blood work and kind of assessing like where my nutritional levels and deficiencies were. And so yours may be a little bit different, but Needed is a brand that I trust. I've used throughout my pregnancies, my postpartum. Roxanne has used them. And so you know that if we're recommending it, it's because it's a brand that we truly love and trust. And so if you would like to check out Needed to help support your pregnancy, your postpartum, maybe your partner needs some support as well, because there is a men's line, you can check them out at thisisneeded.com and use code MamastePod to get 20% off your first order or 3 months of subscription.
The next really common one is pain relief. What is your preferred pain relief option during labor? Do you want nothing? Do you only want IV pain relief? Or if you have nitrous oxide, would you like to only utilize nitrous oxide? or do you want an epidural? And if maybe you're not planning for an epidural, but you decide that you would like an epidural, you could add in there like your code word. If you have like a code word in code action, you can put that on your birth plan so that everyone's aware of what that word is. But also like list out like, hey, maybe if you notice that I'm struggling a little bit, maybe you can offer some IV pain relief at that time, and then I can tell you yes or no. Or do not ask me about pain relief at all unless I ask for it. And that's a really good one to put in the birth plan if you're wanting an unmedicated birth.
Because that is definitely one thing that I find that makes it really hard for somebody that is coping well, but they are like not loving the experience anymore, which a lot of folks kind of are like, I don't know about this.
There's a point.
But if they're wanting an unmedicated birth, it's really hard when someone constantly walks into the room and asks, what is your pain level? How do you feel like you're coping with these?
Which is like a whole nother story, I feel like, because like the whole pain relief, like Joint Commission's requirement of pain, like we have to treat everybody's pain, but like labor is not pain-free. So like you look bad in the eyes of like hospital administration if you aren't treating people and asking them what their pain level is. But also if someone wants an unmedicated birth, maybe don't ask them to rate their pain on a scale of 1 to 10.
Or are you coping well?
Every 1 hour.
So if you are wanting an unmedicated birth, I find it really helpful to, one, be in a birth location that supports that, and then to make it very clear to your medical support team, like, hey, if I understand my pain relief options, and I will ask for them when I want them. Like, please do not bring them up to me, because it's just like a mental thing. Like if somebody's like, are you sure you don't want your epidural? Like your epidural, like that would be like, it can really derail somebody's like experience as they're trying to work through something that's challenging.
And we actually had someone comment about like they had a code word, but their partner like saw them and they're like, no, they are no longer coping. Like I can see them in their face. Like your partner is somebody who knows you ideally the best out of everyone in the room. And they could be like, yeah, I think that they're going to want an epidural, and they will know whether or not to ask. Because they're like, I think she might want something for pain just based off of the way that she's coping with these contractions versus how she was before. So like your partner could be the one that's doing that, not your nurse, especially if you were like, please don't ask me anything.
I also find that when somebody does ask for an epidural, if their plan was an unmedicated birth, we can usually tell, like, yeah, you're not
serious.
Coping well, like this is for real, versus somebody who's in transition, who is like just scared and going through transition and then baby's going to fall out soon. So usually the birth team can also tell, like, this is you like legit changing your mind, which you can change your mind at any time. Like you don't need a code word if you don't want to establish one. We had some folks comment that were like, I don't want to have to remember this code word. Like if you want an epidural, nobody should like lock the door and keep anesthesia from coming in. Like you should absolutely be able to get it if that is what you're wanting. But your team supporting you if you are wanting an unmedicated birth is also very important and helpful.
Another really important thing to put on the birth plan is what you would like done to baby after baby is born. Like, do you want that skin to skin, or what medications do you want? And understanding what is the routine in your hospital. Like, do they normally do skin to skin? How long do they normally do skin to skin? Do they routinely do that delayed cord clamping? And like, what are the routine procedures that they do for you and baby after baby is born? And then if you would like to, veer off of the routine, such as maybe your hospital does 1 minute of delayed cord clamping and you would like 2 to 5 minutes of delayed cord clamping, that is something to put in the birth plan, like the specific time or whatever you're wanting for like the definition of what delayed cord clamping means to you. Because if they routinely do delayed cord clamping for a minute and that's what you're wanting, you don't really need to put that in the birth plan, because they're going to do it regardless. If you're not wanting delayed cord clamping, or you're not wanting 1 minute, you're wanting more, that is something to put in the birth plan.
I usually find that the thing that is usually going to be definitely going to happen in your birth plan is usually what you want done to baby. Like if you want baby to have certain meds, if you want like baby to have a delayed bath, those are probably the things that are going to happen during your birth. Another thing that I would include in a birth plan would be, what are your absolute no's and yeses? Like, what are some things that you absolutely want to happen during your birth and things that you absolutely refuse to have no matter the circumstance? So like for me, I've had some clients that any sort of like instrument assisted delivery, like forceps or vacuums, were absolute no's for them. They did not want that. They would rather have a C-section. than have forceps or vacuum delivery. I've had other clients that those were options that were available to them, and they were like, yeah, that makes a lot of sense to me, and I would like to opt for that if I needed it. So there's no like correct answer to whether or not you should get or not get an intervention, but it is okay to have an intervention that you were like, absolutely not, I do not want that at all. But understand if you're saying absolute no to an intervention and you potentially need it, you're potentially saying yes to the alternative options that are available to you. So understanding what those are and potentially exploring like why this is an absolute no to you can be really helpful. That is not to say that you're somehow wrong for having an absolute no, but we want to ensure that your absolute no's are like actually like no's and not like something that you're just really scared of. Like some folks would be like, I absolutely don't want Pitocin at all. Like, well, what makes you scared about Pitocin? What are your concerns about it? How can we mitigate those? And if you're still like, no, it's an absolute no, like, okay, that's totally fine. So again, not in any way trying to be like, you can't have a no, but just understand like if you say no to one thing, you're potentially saying yes to the alternatives. And so understanding what those alternatives are can be equally important. Another thing that I'll sometimes see with birth plans, and this is more for folks who have had a more traumatic experience in the past, so they had a prior birth experience that they felt like really disempowered or they viewed it to be a traumatic experience, is that their birth plan is very aggressive with, you will not touch me, I will do this. Like it's very accusatory in a way, which I completely understand where it's coming from. Like these are all things that happened to them in their last birth that they viewed to be very traumatic for them. And I don't want to discount or invalidate that at all, but it comes off very aggressive and sometimes the staff can take that potentially the wrong way. So being aware of like the language that you're using in your birth plan, like absolutely communicate things that are really important to you. But understanding like the current staff that's supporting your birth is hopefully not the last staff that you had. Ideally, they're a different group of people.
Different people, hopefully.
If it's the same group of people, be aggressive. It's important to know that the majority of people that are supporting your birth are doing it from a really good place. They want to keep you safe and healthy. They want to ensure that you have a good experience. Their perspective on what they consider good may be different from you. And so communicating that can be really important. Like for me, these are some things that I dealt with in my last birth that were really tough for me, and I would really like to make sure they don't happen again. And so they can kind of come from a place of understanding that you have some trauma associated with an experience like this, and they can be more aware of what they're doing. And so I find that approach is better than like, don't touch me, like I will do this, like do not do anything without my consent, which I would hope that somebody would ask for consent. So just being aware of like, how you are communicating through your birth plan can also like help the staff like be more compassionate towards you. So, hey, I had a horrible experience before. These are some things that happened to me. And this could be stuff that you talk about at prenatal appointments as well. Like I've had clients that had really in-depth conversations with their providers beforehand, and then their team was aware this was some trauma that they had previously, and it may come out during the labor, and it's not meant to be like an offense towards you necessarily. So that's kind of like a hard thing that I'm trying to figure out how to communicate, but just recognizing that the people that are supporting your birth are there to help you. Hopefully, I would say like 90% of the time they're there to help you, and they have really good intentions. And so being honest with them about how you are feeling about the birth can help them be more compassionate towards you.
I do find that when I have a patient who has a very long birth plan with like, people have even like referenced like research articles within birth plans, and usually it's either due to a past experience that they themselves had or somebody else close to them have had poor experiences with their birth, and they feel that they need to be defensive to kind of like get the birth experience that they want because the healthcare team is out to get them, and the only way to get a good, empowering birth is by fighting for it. When that hopefully is not the case for 90% of us, hopefully 100% of us. But having a birth plan with the things that you're wanting can still be very helpful. But when you're adding in a bunch of stuff where you're accusing the staff before they've even done anything to you of like, you're going to try to do all of these things to me and my baby and you're going to derail my birth experience because of X, Y, and Z, that doesn't start the relationship very great. And it can make it hard for the staff to fully support you.
And so this is not to say like you have to accommodate for how the staff is feeling or that you need to like get over your trauma to like make them feel happy or anything like that. Like that is not what we're trying to communicate. What we're trying to communicate is if there's something that happened in a previous birth, and this is where I usually see it kind of come out initially if it hasn't really been addressed, is a really long in-depth birth plan that has a lot of very specific like details that are really important to you. And so those are going to be really important things to discuss like with your provider at your prenatal appointments, to discuss like to your nurse or in triage, and hopefully like you're received well. And then I would definitely say like if there are certain things that you associate with a bad experience and there's certain things that make you feel like more comfortable and safe, choosing a different birth location is going to be a really good option for you. So for me personally, during my first birth, I would view that as a more traumatic and negative experience because of the staff that was supporting me. Now, there were some wonderful members on that staff team. There were some horrible ones that like did not treat me well and really contributed towards a negative experience for me. And so while I was initially planning to give birth in the same birth location and just kind of crossing my fingers that I would not have that same provider again, ultimately, I changed to a different birth location because I knew and I was able to feel really comfortable with the new provider that I had and with like her birth assistant. And I knew who was going to be in my space because for me, the things that contributed towards my trauma were the people in my environment that I didn't have control over, which was the doctor, the midwife, the nurses that were there. But when I was able to pick who was actually going to be at my birth, that really gave me a really positive birth experience. And now this is not to say that you have to have a home birth in order to have a positive birth experience, but if you associate a specific location with not a great experience, potentially considering going somewhere else or potentially looking at hiring like a doula, like working with a therapist to like work through some of that trauma, and then also like expressing to your provider how important it is that you are treated in a different way this time if you are choosing to be in the same birth location.
Normally, when I had a patient who had a really in-depth birth plan, like I fully understood that most of the time this isn't because they think that I'm like out to get them, but due to either an experience they had or somebody else that they know that's really close to them had. So I would normally sit down with them as long as they're not in like the blows of labor. If they're like in active labor, we're going to like talk to the partner. But I would normally sit down with them and go over the birth plan and just ask their opinions and their stories of like, hey, I see that you put that you don't want any sort of Pitocin and that you would not like an IV. Could you explain why you feel that way so that we can fully understand so that I can be able to advocate for you to the provider of like, hey, she would not like Pitocin for X, Y, and Z. Like, hey, she would like not to give a baby a pacifier for X, Y, and Z. All of these things, it helps me fully understand why you're feeling this way so that I can be able to support you and advocate for you to the other staff members. Because understanding that usually like people don't have this view of healthcare negatively for no reason. They're not just like, I just hate nurses a lot for no reason. I have zero evidence for why I just really hate all nurses, especially those labor and deliver ones. I don't know why. I just feel that way. Like, I don't like OBs or midwives either. Like, I can't tell you why. I just don't trust them. Usually there is an underlying reason of why people feel that they need to have a 40-page birth plan with references because they feel that you aren't going to listen to them or trust them, that they have like done this research of what is best for them and their baby. And you may not agree with maybe potentially some of their birth wishes, but it's not our job to choose for you. That's your job. Like, you're the parents, you're the baby. I'm just there to support you.
So a few of the things that I would say are probably not necessary to include in your birth plan, but would be important for you and your partner to like practice and to discuss beforehand would one be like, what labor positions do you want to do? Like, you don't need to put that in your birth plan. Like, you can labor however you want. If you want to use the shower or the tub, you want to get on the bed, you want to be on the floor, just do you. You don't need to like put that in your birth plan necessarily.
I will say if you want to labor in a tub and your hospital only has certain rooms with tubs, I would put that in your birth plan, like if you want to labor in the tub, so that they can be sure if the room with a tub is available, you get into that room. Or if you're only wanting a shower, you're put into that room that has a shower.
So that would be a good, thank you, Roxanne. But like, you don't need to tell them I want to squat and I want to do lunges and I want to sit on a ball or anything like that. But practicing those positions beforehand with your partner can be really helpful so that they understand how to help you get into that position, how they can support you in those positions. The other thing that you don't need to include is what labor comfort measures that you want, such as like, I want my partner to do hip squeezes. Like, that's for you and your partner to discuss. You don't need to put that in your birth plan. Now, you may want to put in your birth plan, like, I would like my nurse to help us with comfort techniques, or I'm really wanting an unmedicated birth. So if you could assign a nurse to me that is really familiar with it, that would be helpful. Like, that would be a good thing to include. But you don't need to put like, I want to squeeze a comb in my hand. Like, those are things for your partner. Unit. Yeah. These are things for your partner to know and for the two of you to practice beforehand. I would say that you don't need to include like what positions necessarily you want to push in, because it's kind of like whatever you end up in. But it would be important to include, I would like to choose the position that I push in. So you don't necessarily need to be like, I want to deliver in hands and knees, but you can put, I would like to choose the position that I push in and that I deliver in. So that would be something that's important to include in a birth plan, but you don't need to like include pictures of like, this is the squat position I want to be in when I give birth necessarily. So thinking about what information is relevant for your nurse to know and your birth team to know so they can help support you and advocate for you in those different things. And then what are things that are just more important for your partner to know and for them to have like awareness of. You can still write out like a plan for them. Like, I had like a little thing written out for my husband of like, these are some labor comforts I would like to do. These are some labor positions I would like to do. I don't like these positions, so don't bother with these. Don't recommend these to me. And so that's something that you can do for your partner is like, this is a list of stuff I would like to try, but you don't necessarily need to include that with like your birth plan. Other things that you probably don't need to include in your birth plan are things that are just standard to your hospital. Now, you can still express them if they're important, like delayed cord clamping, like this is how I define it. The majority of hospitals are probably going to do skin to skin. They're probably going to do delayed cord clamping. They're probably going to do a delayed bath, and they're probably going to do the golden hour, baby stays on your chest for about an hour. You can still include all those things if they're super important to you, but know that like the things that are standard to your birth location, you probably don't need to like overemphasize within your birth plan either.
But understanding what those standard procedures are. So asking like, hey, when baby's born, what does it look like for you normally in the hospital? Like, is it golden hour until baby does that first feed, or is it an hour? Like, what does that look like? And are they like leaving me alone for that full hour? Or are they like doing a bunch of stuff to baby while baby's skin to skin? What medications are standard? Because if you're delivering at home, like they're not going to give certain medications as they might give at a hospital. The delayed cord clamping, defining it, delayed baths, what is the delayed bath there? And is there any like extra paperwork that you need if you decline any of those standard routine procedures, as well as maybe if you didn't want baby to get a bath at all, do you need to like sign anything as well? So asking what the standard procedures are in your hospital, such as with the IV, with baby, the monitoring, can be helpful to determine what to actually put in your birth plan. Because again, it is standard that everybody gets a skin to skin for 1 hour with your baby with minimal interventions, you probably don't need to add that to your birth plan.
So what do you do once you've developed like your general birth plan? Like, these are the things that you would like to happen during your birth. These are your preferences. If there's a different path that your birth takes, like if you have to be induced, these are the options I would like to explore first. You can take your birth plan and you can bring it to your provider and you can be like, hey, can you look this over with me and let me know what in my birth plan is realistic at your birth location versus what is just not going to happen. So if you were like, I want to labor in the tub and give birth in the tub, but your birth location does not have a tub, that would be an unrealistic expectation for your birth location. So understanding like what is available to you versus what is not by discussing it with your provider can be super helpful. Or if you're like, I want nitrous oxide, and they're like, we don't have that. Like, well, it's hard to get nitrous oxide if they don't have it at their birth location. Another person that you can discuss a birth plan with would be your doula. Like, if you hired a doula, this is something that I usually do with my clients, is about like the 36-week time frame. Like, we sit down and we go over their birth plan. We go over like what their preferences are. And because I'm familiar with their birth location, I can let them know certain things that are important to emphasize for them. Like, okay, at this birth location, it's really important that we emphasize this in your birth plan. And this is something that your husband and I or your partner and I are going to emphasize to the staff as well that is really important to you. I also have an opportunity to develop a relationship with my clients throughout their pregnancies. And so there are certain things that I'm going to know are very important to them, or things about their background that I'm going to know that are going to potentially impact their birth experience that I can also help the staff navigate with communication as well. So that could be another person that you discuss your birth plan with. It doesn't have to be just your provider. It can also be somebody who's familiar with your birth location, such as a doula. And if you haven't hired a doula, potentially some of them will do like a consult with you where they go over your birth plan as well. Even if you haven't hired them as like your specific doula, like you can do like a small session with them to like go over your birth plan to see like whether or not this is realistic, especially if there's like a specific vision that you have for your birth. And once you've kind of gone over your general birth plan, you can start to figure out like what other options do you have available to you, and then your preferences for those options as well. And like we discussed before, there are different ways that you can learn about what is available. One, you can take a childbirth education class, either one that's offered at your hospital. You can take an independent childbirth education class like ours. Ours, we include an entire section about birth options that are available, the risks and benefits of them, and possible scenarios that you may or may not want them. We also include a more in-depth section of our course that's all about birth planning, where we discuss the different paths your birth can take and possible scenarios, so that you have a better idea of like what to kind of expect during your birth and what to prepare for as well. So hopefully this episode was helpful for you to have a better idea of what to do when it comes to birth planning. It can be really overwhelming. There's so many options that are available to you. And so it's important to note that while we cannot control exactly what happens in our birth, we can still be in control of the decision-making authority in our birth experience when we understand what our options are, our preferences for those options, and we have a team that's ready to advocate for us every step of the way. Thank you for listening to this episode. If you enjoy this episode, be sure to like and subscribe to our channel so you get notified whenever we release new podcast episodes. We release new episodes every Wednesday and new birth stories every Friday.
And if you're looking for a birth planning template, you can grab our free birth planning template as well as a hospital packing list in the show notes below. This podcast is sponsored by Needed, a nutrition company focused on the perinatal timeframe, and you can use our code MamastePod for 20% off your first order or the first 3 months of your subscription at thisisneeded.com.